Do GLP-1 medications actually worsen depression? This study looked at nearly 100,000 people to find out. Welcome to Science My Health, your channel for health and research information. GLP-1 receptor agonists are widely used to treat type 2 diabetes and obesity. But in recent years, concerns have been raised about whether these medications might worsen depression, anxiety, or even increase the risk of self-harm. A large national study published in the Lancet Psychiatry examined this question closely, and the findings may be reassuring for both patients and clinicians. Researchers in Sweden studied nearly 100,000 people with diabetes who already had depression or anxiety. They found that some GLP-1 medications, especially semaglutide, were actually linked to a lower risk of worsening mental illness, not a higher one. To understand why this matters, we have to look at the diabetes-mental health connection. People with diabetes are more likely than the general population to develop depression and anxiety. These conditions can make blood sugar control more difficult, and poor metabolic control can worsen mood symptoms. This creates a cycle in which physical and mental health affect each other. GLP-1 receptor agonists help regulate blood sugar and reduce appetite. Some past studies have suggested they might improve mood, while others raise concerns about possible psychiatric side effects. Because results have been mixed, the researchers wanted to examine the issue using a study design that reduces bias as much as possible. Here's how the Swedish study was designed to reduce bias. This was a national cohort study using Swedish health registers from 2009 to 2022. It included 95,490 people with a diagnosis of depression or anxiety who were using non-insulin anti-diabetic medications. 22,480 people used a GLP-1 receptor agonist. The average age was about 50 years, and about 60% of participants were women. Researchers used a within-individual design, meaning each person served as their own comparison. Periods when someone was taking a GLP-1 drug were compared with periods when that same person was not taking one. This approach helps control for baseline mental health severity and other personal characteristics that don't change over time. The primary outcome researchers were watching for was worsening mental illness, defined as psychiatric hospitalization, sick leave longer than 14 days for psychiatric reasons, hospitalization due to self-harm, or death by suicide. Secondary outcomes included worsening depression, worsening anxiety, substance use disorder, and self-harm. The results showed clear differences between specific GLP-1 medications. Semaglutide had the strongest protective association. Compared to periods when people were not using GLP-1 drugs, semaglutide use was associated with a 42% lower risk of worsening mental illness, with an adjusted hazard ratio of 0.58. It was also linked to lower risk of worsening depression, lower risk of worsening anxiety, and lower risk of substance use disorder. Even when the analysis was restricted to hospital admissions only, semaglutide was still associated with reduced risk. Liraglutide also showed benefits, though more modest. Liraglutide was linked to an 18% lower risk of worsening mental illness and a lower risk of worsening depression. It was also associated with reduced psychiatric sick leave. However, its benefits were not as broad or as strong as those seen with semaglutide. Importantly, not all GLP-1 drugs behave the same way. Exenatide and dulaglutide were not associated with reduced risk of worsening mental illness. That suggests this is not simply a class effect shared by all GLP-1 drugs. Instead, individual medications may differ in their psychiatric associations. There was also a signal for lower self-harm risk. When GLP-1 drugs were analyzed as a group, they were associated with a lower risk of self-harm. Only one suicide occurred during GLP-1 use, and suicide deaths accounted for just 0.2% of the main outcome events. So, why might a metabolic drug affect mood in the first place? There are several possible biological explanations. GLP-1 signaling may reduce inflammation in the brain. It may influence serotonin and dopamine pathways involved in mood regulation. GLP-1 activation may support neuronal survival and reduce oxidative stress. And weight loss and improved metabolic control could also indirectly improve mood. However, this study does not prove that weight loss directly caused mental health improvement. The relationship is likely complex and multifactorial. Of course, there are important limitations to keep in mind. Because this was an observational study, it cannot prove causation. There might also have been improvements that would have naturally occurred over time. So this study doesn't account for that. There were no direct measures of symptom severity, no data on body weight or HbA1c changes, and limited statistical power for some drugs. The results are also based on the Swedish healthcare system, which may differ from other countries. Still, the very large sample size and the within-individual design make these findings strong and clinically meaningful. So, what does this mean for patients right now? This study provides reassurance that GLP-1 receptor agonists, especially semaglutide, are not linked to worsening depression or anxiety in people who already have these conditions. In fact, they may be associated with improved outcomes. For patients living with diabetes and depression or anxiety, these findings are encouraging. Like this video if you learned something new, and subscribe to Science My Health for more health research news.